Good morning, everyone, dear panel and ladies and gentlemen. I'm Samitha Sulochana. I'm following an advanced diploma at IIHS. So I'm going to present my study on awareness of postnatal exercises among women in Sri Lanka on behalf of my team. So these are my key contents that I'm going to brief you on today. So moving to introduction, as you all know, delivering a baby is a major milestone in a women's life, which occurs both anatomical and physiological changes in a women's body. So these changes in the female body after delivery can lead to many significant problems, especially the musculoskeletal problems, which can persist even throughout their life. So for that, in a physiotherapy aspect, we are prescribe them a postpartum exercise, or else we are calling it as postnatal exercises. So we advise them to start these postnatal exercises from first week to up to 24 weeks. So these exercises can address for their musculoskeletal issues which arise with their delivery. So the musculoskeletal issues that mainly occurs after the delivery are diastasis recti, which means after the delivery, during pregnancy period, their rectus abdominal muscles will lax and it will stretch. So this laxity can remain after the delivery also. So they should reduce this gap between both rectus abdominis muscles. So also, as I mentioned before, they can have ligament laxity and muscle laxity because of their delivery. It mainly can due to the hormonal changes and other changes, and also joint hypermobility and back pain, both extremity pains, lower and upper, and incontinence, and the other musculoskeletal issues. So moving to justification, so studies have demonstrated that these postnatal women or postnatal mothers are at high risk for physical inactivity. This is mainly because they are engaging with their child work. So in their leisure time, what they are doing is they just they won't engage with more physical activities during this time. So also understand the beliefs, barriers and enables regarding physical activity during the postpartum period can help to more effectively tailor physical activity intervention. And as I mentioned before, after the delivery, they can have lots of musculoskeletal issues. So in order to reduce or prevent those musculoskeletal issues, it is important to know about the postnatal exercises. So my objectives are to assess the awareness and attitudes about postpartum exercises among women in Sri Lanka, and to identify the awareness of physiotherapy among postpartum women. So this is a quantitative research. My population are postpartum women in Sri Lanka. Mainly I took for my study from the first week of delivery and up to 24 weeks of I mean the first week after the delivery and the 20 up to 24 weeks. So my sample size was 100 women in western province of Sri Lanka. I selected it by convenience sampling method, and the data collection was done by using an online questionnaire. So and my exclusion criteria was the individuals who refused to give their consent and the mothers who has children aged more than 6 months. Also my inclusion criteria is the women who has children aged up to 6 months, and I use SPSS and Microsoft Excel softwares to analyze my study. So moving to results, you can see from the first chart, majority of them are in age between 30 to 35 years, and also in my research I looked their education level as well. So there are more graduates, and there are more women that have a significant education level has identified. So regarding their delivery types, majority of them had normal and cesarean deliveries, and also regarding their antenatal history, 84% of mothers are single pregnancy mothers, and 79% of them are having a 1 to 3 child in their previous deliveries. Also significant amount of mothers having diabetes and the hyperlipidemia. And regarding their daily activities, most of them are the active, but it's not significant. They are not significantly active, but they think like they are active in their way. Also, most of them are complain that they have tiredness in their day-to-day activities, and also regarding the awareness of postnatal exercises, I have identified that 48% of them are not aware of the postnatal exercises, and regarding their attitudes towards the exercises, you can see that most of them are thinking that it is bad for their health, because just after delivery doing exercises is bad for their health. So you can see here majority of them, which is 82%, has musculoskeletal pain. They are suffering from musculoskeletal pain, and but you can see from that graph they are not taking physiotherapy treatment for their musculoskeletal pain, though they suffer. And also I just look what are the reasons for their why they are not taking physiotherapy treatments. So most of them have said that due to their busy schedule they couldn't go for physiotherapist. So in conclusion, the findings shows that through the participants, though the participants are suffering from the musculoskeletal pain during their postnatal period, they are not taking a physiotherapy treatment or the postnatal, they are not doing the postnatal exercises. And also it shows that majority of them are not aware of postnatal exercises, and the knowledge about their physiotherapy knowledge is significantly low. So my recommendations are to assign a team of physiotherapists in the maternity wards, and organizing workshops about postnatal exercises in healthcare team. It means among the doctors, nurses, and midwives and other team. So also delivering leaflets about postnatal exercises and importance of physiotherapy among mothers, and also giving follow-up charts for exercises program, then they can follow up with their postnatal exercises. So these are my references. I would like to thank Dr. Kitsiri, Dr. Nishan and IIHS Scientific Committee, and especially to Dr. Madhushani and all the participants. Thank you.
Right.